the Lieutenant Governor, as well as Dr. Carol Rattay, who's the Director of the Delaware Division of Public Health, Saran Cade, who's the Secretary of the Delaware Department of Labor, and Damian DeStefano, who's the Director of the Delaware Division of Small Business. We've also been holding small business recovery town halls. We had our 5th today to engage with the small business community around recovery and reopening. Please visit de.gov/economy for details on the reopening and recovery effort and to offer public feedback. And we're going to have some opening remarks from the speakers on the call, starting with our Lieutenant Governor here in a second. And then we're going to take questions, many of them pre-submitted, and also questions from the comments tonight. So with that, please do visit de.gov/economy, and I'll turn it over to our Lieutenant Governor, Bethany Hall-Long.
Good evening. And thanks everyone for joining us this evening on our second Community Economic Town Hall. I'm Lieutenant Governor Bethany Hall-Long, and I'm really so happy that you've joined us this evening, along with our Secretary of Labor, Saran Cade, our Director of the Division of Public Health, Dr. Carol Rattay, and Damian DeStefano, our Director of Delaware's Division of Small Business. Governor Carney, as you know, announced a series of recovery town halls to engage us as Delawareans and Delaware business and how we can safely open Delaware's economy. As the governor has stated many times, we need to have a healthy community before we can have a healthy economy. But we really do look forward to having your input and having a plan, and we need that. So tonight, we're here to gather your thoughts so that we can reopen safely when the time is right. We all know that our lives have changed over the past few weeks, and we have to function and operate very differently and have been totally kind of upended. So as we move forward and we work toward creating a plan to reopen, we need to establish that balance between fully opening the economy and ensuring that Delawareans are safe and healthy. That means a new normal is going to be a little different than what we've been accustomed to. So tonight, as we move forward, I'd really like to thank a lot of the local officials who've joined us. And it's quite a number, and it shows their real commitment to each and every one of you. We're joined tonight by our Senate Pro Tem McBride, our Senate Majority Leader Poore, our Senate Majority Whip Townsend, and our House Majority Leader Longhurst, and our House Majority Whip Mitchell. We have a series of senators and representatives, including our Senior Senator Harris McDowell, Senator Brown, Lockman, Sturgeon, Cloutier, Delgado, Sokola, and Walsh. And I apologize if we've missed any of the other senators. Also from our House of Representatives, we have a number who've joined us. Representative Bolden, Dorsey Walker, Brady, Chukwuankoto, Kendra Johnson, Representative Heffernan, Siegfried, Matthews, Griffith, Cook, Minor Brown, Representative Bentz, Representative Williams, Bombach, Ozenti, Kawako, and Biola. A lot of commitment here. And we have a number from our city council as well as Newcastle County. And a number of our cabinet secretaries or their offices have joined in as well. These leaders within our local community, just like all of us, are very committed to getting this right. Just like the mayors and others who've been in the front lines in our communities and our many first responders, we want to thank them during their work and their effort during the pandemic. And we understand that we need to gather this information from all of you to inform Delaware as we plan our economic reopening. We hope to hear about your experience, your thoughts, to best inform us as we move forward. And again, we recognize that's not only business, but also those of you in education and healthcare. Please feel free. It's really important that we hear from all of you and that you visit de.gov/economy. And tonight, participate in the live chat. Fill out the form again in the bottom of your site, de.gov/economy. We may not get to everybody's questions this evening, but we will definitely be reading and tallying your comments and your insight. So I know a number of you have already submitted questions and comments for tonight via our website, and we really appreciate that. So we will be posting a link to where you can find the details about Delaware's economic reopening. Again, we've been pleased to have expanded testing here in Newcastle County, where tonight we are focused. And last week, we know Governor Carney declared a COVID-19 hotspot in Sussex County. As a result, public health has been working diligently statewide with you to address this, and we have welcomed extra support from the Centers of Disease Control and Prevention, along with our area hospital systems. And a big thank you to all of you in that front line. Additionally, we know that Governor Carney has modified a number of our executive orders, calling for things for our personal protection and our protection of our loved ones, including face coverings in public. And I'm sure we'll be getting a few more additional executive orders over the next few weeks as we look to continue to protect ourselves. I'm sure we'll get questions and different topics tonight, and I look forward to an informative conversation. So, at this time, again, thank you for coming out. Please participate in the chat. And it's time now to hear from those experts who've been in the community who hopefully can answer your questions. And it's my pleasure to introduce Secretary Saran Cade, who will then introduce, I know, in a bit, Dr. Rattay, as well as then Damian DeStefano. So I'm going to start today with our Secretary Saran Cade and have him do a brief introduction. And after he speaks, we'll go right to Dr. Rattay, and then we'll go to Damian, and then we'll be coming back to our moderator. Secretary Cade, thank you.
Thank you, Lieutenant Governor, and to all of those who joined this evening. Again, Delaware has been weathering an incredible storm that made its way here about a month and 2 weeks ago. Unemployment Office has received a highest number of claims that we've received in modern history. We've received over 80,000 claims to date, and we have been able to process over 60,000 claims and provide over $68 million in benefits over the last 6 weeks. So it's an extreme number of claims that we're seeing, and it's an extreme number of individuals and families who are experiencing some difficult times right now as a result of many of these closures. So our agency has been focused nonstop on making sure that we can stand up benefits for these workers. We have announced today that we have rolled out a start date of next week for benefits to be available to self-employed and independent contractors who were previously not able to apply for benefits. So our agency and along with state government has been trying to assist individuals at being able to weather this storm and staying in place, staying at home in place. So I'll turn it over to Dr. Rattay to give as much time as we can for questions. Dr. Carol Rattay.
Thank you so much, Secretary. Thank you, Lieutenant Governor. Good to be with you all. I will be very brief as well, but I will say, obviously we are dealing with something that, most everyone in our lifetimes have never addressed before. And while we are working to help keep Delawareans safe all across the state, we certainly have had, a lot of concerns and a lot of focus on long-term care, as well as our neighbors down in Sussex County, where, as the Lieutenant Governor mentioned, we have been dealing with a hot spot. And we also had a lot of concerns about some of our other more vulnerable communities and populations in the state. So while we've been, working really hard across all those fronts, we've also been working very hard on getting the things in place that we need to have in place to help keep Delawareans safe as we have less infection in our state. And so that means things like more testing, and testing has been a challenge for us, having adequate testing supplies, but we're ramping up testing. We are ramping up what's called contact or case investigation, which when you identify a case, you want to learn everything you can, and you want to get that person isolated. You want to identify their contacts, and you want to get those contacts into quarantine if they need be. All those things are really important for us keeping the state safe once we get to a point where we can reopen. There's also many other are things that are just going to be part of our new norm. So face coverings, it's just going to be part of our new norm. Social distancing, it's going to be part of our new norm until we have treatment and vaccine. So I'm happy to talk about any of those facets of this response, and I'll hand it over to Damien.
Thank you, Dr. Tay. My name is Damien DeStefano. I'm the director of the Delaware Division of Small Business. We're working on trying to assist small business owners through this time, both through support programs and also using our platforms to encourage people on how to find new ways to enjoy some of the small businesses throughout Delaware that have changed the way that they operate. I'm interested in talking a little bit about the state's plan around reopening. I think it's just important to remind everybody that it's really important as we head into this phased reopening that we remain diligent. I think what we want to be able to do is get back to allowing businesses to operate at some level as quickly as possible. We've heard from lots of business owners and employees of businesses about the frustrations they're having or the difficulties they're having. But if we don't do that in a way that is conscious of the public health situation, we're going to end up moving backwards as we try to reopen. So really important that we remain diligent as we enter this next phase.
Great. Thank you, Damien. I think now we'll turn it over to our moderator at this time, Jonathan.
Thank you, Lieutenant Governor. So we're going to start first with a few questions that we got pre-submitted. Damien, I think we'll go right back to you. We have a question here. If I can, Kathy Stiles, who asks, when can stylists and salons expect to go back to work in the phases plan, May 15th or later? I know this is a question we've heard a lot in our small business recovery town halls. Can you talk at all about stylists and salons, cosmetology generally?
Sure. Yeah. So cosmetology poses some challenges from a social distancing perspective because there is no way to cut somebody's hair and maintain safe social distancing. That being said, I know several states have tried to look at ways to take measures to allow them to reopen as part of a phase one. We're using the federal government, the Center for Disease Control phases in terms of how we reopen. And we're working with folks in that industry in Delaware right now to try to come up with something that promotes a safe environment in a phase one reopening, which will still be a fairly limited reopening with, again, a lot of care paid to the public health side of this.
Thank you, Damien. Here's another question that we've heard, and maybe we'll start with Dr. Rattay on this one. This is a pre-submitted question from Jim McBride. Jim says, why can't we plan for a county by county reopening like other states? I know some people are hearing this out of Pennsylvania. Jim says Governor Carney commented that he wasn't supportive of that approach. Why sacrifice a large population in Newcastle County for the hotspots in Sussex? Dr. Rattay, can you talk about a county by county approach and any pros and cons to that in Delaware?
Yeah, I mean, from a public health perspective, and I do understand why people are asking that question. I've heard that question a fair amount. In Delaware being a small state, people do move from county to county. Sometimes people move from Newcastle County all the way to Sussex in one day. So, I do think we have to acknowledge that there are many people who, and I travel from Newcastle County to Dover every day, and Route 1 is busy. There's a lot of people who are, whether they're providing essential services or traveling for other reasons. There is a lot of travel across our counties. So I also know that the governor believes that just taking a consistent approach across the state it certainly leads to less confusion. So, there's not a super easy answer to this, but, ideally we see improvements in all three counties, and all three counties are safe as we begin to phase reopening.
Thank you, Dr. Rattay. Secretary Cade, we have a lot of questions like this pre-submitted as well from Darlene Henderson, who asks, I would like to know when are they starting the pandemic emergency unemployment for independent contractors? Darlene works in an independent contract job, and she sees that Philadelphia is starting filing for pandemic emergency benefits. And I know you talked about this at the beginning. For anybody who's joined, can you talk about what we're doing for independent contractors?
Yeah, so I appreciate the question. First, every state is going to be moving a little bit differently. So Pennsylvania definitely has started accepting applications to this point. So has New Jersey and some other states. Again, some of these states are going to be doing this through brute force with the thousands of employees that they have in their unemployment office. That's going to change the amount of time that it's going to take for them to be able to stand up a program, because they're going to try to do a lot of it manually. Delaware, we just don't have that luxury of being able to deploy that many employees to the task of filing or processing that number of claims individually. So because we're starting from a different place, and we have to design an automated system in order to do that work for us. It takes a little bit longer of a time than if we had 1,000 employees at unemployment to try to process these claims individually. So because of that, it's taking a little bit more time to design a system that fits our needs. What we've announced today is that we expect to be able to stand up this program and begin taking applications for independent contractors and self-employed next week. And so we've issued on our website and on our social media page guidance as to how independent contractors can prepare to apply through the new system. Again, we understand that it's taken a good amount of time from when the law passed, but I think it's also important to recognize that the federal government provided us guidance about 3 weeks ago.
Sounds like we may have lost some sound there from Secretary Cade.
Yes.
We'll come back to that independent contractor question as well later. We have some others there.
The last state to roll it out, but Delaware definitely was not in a position to be the first state to roll that out.
Thank you, Secretary Cade. Here's a big question for you, Dr. Rattay, from Elizabeth Toney, who's Delaware's plan to increase testing for COVID-19 and COVID-19 antibodies. The only way to reopen, she says, and truly know how widespread this virus is, while also increasing contact tracing, is to do more testing. How will you ensure that those who return to work are free from the virus and safe in their communities?
Great question. And it is absolutely a critical question and an important part of our strategy, increasing testing, which, as I mentioned, has been a real challenge to have adequate testing supplies. And it remains a challenge, but we're making some forward movement on a number of fronts. Increasing the diagnostic testing, or the PCR testing, especially for people with symptoms, is really, really important. But also increasing access to antibody testing is also really important. We've been able to acquire an increasing amount of antibody testing, and more will be coming into the state very soon. And that's going to be really important for especially essential workers and extended essential workers as they are going back to work and are exposed to individuals in the public to know if they are at risk, or if they perhaps have already had the infection. We are so lucky in our state that we have such a great healthcare system network. And we learned from the White House on Friday that we're in the top 15 of states for testing. And that really is due to the collaborative approach that we've been able to take with hospitals across the state to have testing available at stationary testing sites really for the last 2 months. Additionally, a lot of pop-up testing sites or events have been completed in a variety of ways, but we're really looking to ramp up at least 3 times, if not 4 times more, the testing that is being done in our state very soon. And so that also means, we'll continue to collaborate with the hospitals who are willing to step up and even do more. But primary care doctors, pharmacy, urgent care, and other a variety of different community events, especially focused in areas where we have the greatest concerns, is a big part of what we're looking at in our future here.
Thank you, Dr. Rattay. And a medical question follow-up here from Nancy, pre-submitted, who asks, this might be a difficult question, but can you get COVID-19 twice? And how can I get tested to see if I had it several months ago? Any advice?
Yeah, so there's a lot we don't know about this virus, and I think this virus surprises us all the time. There is evidence that people
that we hear that a lot, and there's economic reopening. Again, we've been pleased to have expanded testing here in Newcastle County, where tonight we are focused. And last week, we know Governor Carney declared a COVID-19 hotspot in Sussex County. As a result,
thank you, Secretary Cade. Here's a big question for you, Dr. Rattay, from Elizabeth Toney, who's Delaware's plan to increase testing for COVID-19 and COVID-19 antibodies. The only way to reopen, she says, and truly know how widespread this virus is, while also increasing contact tracing, is to do more testing. How will you ensure that those who return to work are free from the virus and safe in their communities?
Great question. And it is absolutely a critical question and an important part of our strategy, increasing testing, which, as I mentioned, has been a real challenge to have adequate testing supplies. And it remains a challenge, but we're making some forward movement on a number of fronts. Increasing the diagnostic testing, or the PCR testing, especially for people with symptoms, is really, really important. But also increasing access to antibody testing is also really important. We've been able to acquire an increasing amount of antibody testing, and more will be coming into the state very soon. And that's going to be really important for especially essential workers and extended essential workers, as they are going back to work and are exposed to individuals in the public, to know if they are at risk, or if they perhaps have already had the infection. We are so lucky in our state that we have such a great healthcare system network. And we learned from the White House on Friday that we're in the top 15 of states for testing. And that really is due to the collaborative approach that we've been able to take with hospitals across the state to have testing available, stationary testing sites, really for the last 2 months. Additionally, a lot of pop-up testing sites or events have been completed in a variety of ways, but we're really looking to ramp up at least 3 times, if not 4 times more, the testing that is being done in our state very soon. And so that also means, we'll continue to collaborate with the hospitals who are willing to step up and even do more. But primary care doctors, pharmacy, urgent care, and other a variety of different community events, especially focused in areas where we have the greatest concerns, is a big part of what we're looking at in our future here.
Thank you, Dr. Rattay. And a medical question follow-up here from Nancy, pre-submitted, who asks, this might be a difficult question, but can you get COVID-19 twice? And how can I get tested to see if I had it several months ago? Any advice?
Yeah, so there's a lot we don't know about this virus, and I think this virus surprises us all the time. There is evidence that people have gotten reinfected. And although it seems like it's probably pretty rare, it has been seen. And so the antibody test is a test that can help you see if you've had an immune reaction to the virus, and that's really helpful to know. The antibody test is going to become much more widely available. So with primary care providers, as well as urgent care in the not too distant future, where people can find out if they have had the infection. But what's really important is for people then to also realize just because the antibody test shows that they've had infection doesn't mean they're not going to get it again. And so while everybody is going to have to social distance and wear face coverings, etc., even those who've demonstrated that they've had the virus will need to do the same until we know more about what immunity means.
Thank you, Dr. Rattay. A question for Damien. We've had several questions here, so I won't read any one of them, but about the HELP program and eligibility for the HELP program. Can you talk about what businesses are eligible and that program generally, and maybe what federal resources also may be available for small businesses, Damien?
Sure. So the HELP program was a program we launched back in March that's really targeted at the restaurant industry, the hospitality industry more broadly, hotels, and leisure activities. At the time, it seems like a long time ago, they were the very first folks who were almost completely shut down by this. We expanded the program to apply also to personal care services, which is a broad category that includes a lot of the small businesses in the cosmetology field and related services like that. And the way that the program works is it provides $10,000 loans to cover fixed expenses. The thinking behind it was a lot of business owners in those sectors early on were seeing their revenues fall almost to zero or sometimes by 75% or more. But we're still facing a lot of the expenses that they expected to have revenue to cover, like a rent payment, a utility bill, a mortgage, an insurance payment. And we wanted to make sure that when we did get to the other side of the pandemic response, which is still ongoing, that we had as many of those businesses able to reopen as possible. And so that's what the program's really aimed at doing. It's a zero interest loan with no payments until January 2021. So we've been able to get that out to over 100 businesses now to try to assist them through this period of time. The federal government program, which is much larger in scale given the resources of the federal government, is the Payroll Protection Plan. And that is a loan, a forgivable loan that's issued against the payroll of a company. It's through a bank. A company gets it. They have to be able to rehire a certain number of their staff, try to get to 100% of their it goes back to February 2020 staffing levels by June 30th. And if they get to that point, they get the loan forgiven. So that's been an incredibly popular program. I know it's helped many businesses throughout Delaware. I think more than $1 billion in payroll protection plan loans have gone to Delaware companies, and nationwide, close to $700 billion of payroll protection plan loans have been issued. And if you need any more information about these things, we have a website, business.delaware.gov/coronavirus, where we have all of the different business assistant programs available for anybody that wants to find out what they might be eligible to apply for.
Thank you, Damien. And that's a good time to plug our other websites here. Please visit de.gov/economy. You can learn more about the reopening and recovery effort there. For those who are just joining us, there's a form at the bottom of the page. We're doing these town halls to collect your feedback, so please fill out that form and let us know your thoughts on reopening and recovery. Also, for the latest updates on coronavirus in Delaware, visit de.gov/coronavirus. A link there to data, and we're getting a lot of questions, Dr. Rattay, about data. Steve Rosen in the Facebook comments asked, can you talk about the metrics to reopen? That might be difficult, but he says, what are the metrics? What are the metrics, Dr. Rattay, that we're looking at on a daily basis that are not cases? We heard this in our small business town hall earlier, that cases, as we do more testing, will go up. So can you talk a little bit about the metrics that aren't related only to cumulative cases and what you look at on a daily basis?
Yeah, absolutely. So it's true. Cases, although in the White House reopening plan had suggested that we look at cases, and we will look at cases continuously long term. As we're really ramping up cases, we expect our numbers to go up. So that's not a great indicator. Hospitalizations is a good indicator in that it's not so much dependent on how many people you test. It's really based on who's sick enough to be in the hospital. We have been able to work with the DIN, the Delaware Health Information Network, and to look backwards and get a better assessment of new hospitalizations every day. New hospitalizations is an indicator that is really a Delaware specific indicator we came up with, but we think it is a good indicator to help us see, how many people are newly becoming sick enough to be hospitalized, because we know a lot of people in the hospital have been there for a while. Another important indicator is the percent of people tested who are positive. Again, this one isn't so much dependent on how many people you test, but it can be influenced by how many people you test. But in general, it tells you kind of what's the prevalence of infection in the community. So as this is getting under control more, we should see that number decreasing. And then another one that we're paying a lot of attention to is called CLI, or COVID-like illness, which is symptoms that are pulled out of an emergency department and hospitalization database that is a tried and true method that we use for influenza every year. And every year, as we start to get over our hump, we see decreases in ILI, we call it. So the other places that have already gotten over their hump have also seen a decrease in CLI, or COVID-like illness. So you'll see all of these metrics on My Healthy Community. I will tell you, we also very importantly, is our state ready? And so we have metrics that are, are we ready for testing? Are we ready for case investigation and contact tracing? And very importantly, do we have the PPE, the personal protective equipment, in our state? Because we still have some shortages in some of those areas, like gowns and gloves. And if we're reopening, and many people are going to need those that PPE. Additionally, as we reopen, and if we start to see more people in the hospital, we got to make sure that we've got enough PPE in the state.
Dr. Rattay, so this is a difficult question, but one we get a lot, and I don't know who wants to take it. Maybe the Lieutenant Governor can talk a little bit about it. But Kimberly Hill in the Facebook comments asks, when will the beaches open? I know that the beaches were closed. We saw a lot of out-of-state traffic at the beaches early in March, and so Kimberly Hill wants to know, when will the beaches reopen, and how does that fit into our reopening plan?
Good question. I will say that we hear that a lot. And one of the nice things that has occurred over the past 2 months, if you can say anything nice has come of COVID, really hasn't been a lot of nice things, but one of the strengths has been the communication across state jurisdictions. I think we've had a lot of leadership with our governor.
Comments we have linked to back.
The cost that is going to be approved in state government as a result. There's essentially
Generally about budget impact of unemployment, the unemployment numbers we're seeing. I know you said they were unprecedented.
Kind of reopening in phase one industry. But yeah, thanks, John.
That DPH follows on a daily basis.
But at Healthy Lifestyles, one last point I'll make before we go to questions. I know we have around 30 minutes or so here before we round out to the 7 o'clock hour. We also know from a healthy lifestyle perspective, Dr. Rattay and I and others and many of the electeds who are also on this evening, one individual's out exercising, one individual's walking, but doing that per the protocol as a direction of the executive order. So again, to Kim's point, before we can go down as a group at the beach, it's going to be a little while. But again, we just thank you for asking those questions and reminding you if you're out for a jog alone or a walk alone, those activities at our parks, whether at Bowers Beach, and tonight I know we're here up in Newcastle, whether it's on the river walk, again, safe exercise is allowed. Okay, Jonathan.
Thank you, Lieutenant Governor. So just in the comments, we have linked back to the metrics question to myhealthycommunity.dhss.delaware.gov. That's the site that Dr. Rattay mentioned a minute ago. You can take a look at that site for the latest data that DPH follows on a daily basis. I think this next question is for Damien. This is from Ann Reskauskas in the Facebook comments, who says, I am a real estate broker in Bethany Beach. When will the governor give us the next update concerning our short-term rentals, because we need to start planning? Also, does the state have any plans to offer assistance to agents who will lose commission? Any thoughts generally on real estate and the impact on real estate as we reopen?
Yeah, thanks, John. We've been working closely with representatives from the real estate industry to try to make sure that we're staying on top. There's actually, and part of this for me has been education on all the different layers when you get into the real estate industry, between just sellers of houses, long-term renters, short-term rentals, some of the ways that one is more leisure focused and the other is obviously a long-term purchase and things like that. And so we're working on we've developed guidance throughout this process for each of those specific segments. And now we're in the process of developing a plan for some kind of reopening in phase one. Some of that will depend on what's done around some of the interstate travel rules, because a lot of that traffic comes from other states into our state. So that's another piece of it. But then what the rules around it as well are something we're actively working on.
Thank you, Damien. Question for Saran, Secretary Cade. We got this question last time as well, a couple in the pre-submitted. Can you just talk generally about budget impact of unemployment, the unemployment numbers we're seeing? I know you said they were unprecedented. Maybe you can talk about those numbers and the budget impact on the state of Delaware.
Yeah, so it's a great question. The federal government has committed to allowing states to withdraw loans in order to ensure that there's essentially cash on hand to provide benefits to workers who are in need. The federal government has offered to reimburse the $600 added benefit that they are providing. They have also committed to providing reimbursement for the initial first week's benefit for all individuals on unemployment. And so the amount that pretty much comes up to is probably a little bit, we're projecting to be probably a little bit over $500 million federal assistance. This will more than likely leave about $400 million that is going to be up to the state to try to figure out how to backfill. And again, these are all estimates. We will know more as time goes on. But the expectation is that we will be able to utilize the part of the $1.25 billion that the state has received from the federal government in order to cover that cost for unemployment benefits. Of course, this will not cover every single cost that is going to be approved in the state government as a result of COVID-19, but that will provide a good amount of relief, hopefully for a lot of businesses and workers to prevent from increased unemployment taxes in the year to come. So we recognize that we're not going to be able to get this done without the federal government in their role. There are going to be other changes to the CARES Act that we're going to see coming down the pipe that hopefully will provide other relief to state budgets as well. But again, we're nowhere near out of the woods when it comes to that.
Thank you, Secretary Cade. Another question for you, Dr. Rattay, and something I know you think a lot about it. Deja Dupree asks in the Facebook comments, how are we verifying the tests that we receive are accurate and not giving false negative or positive results?
Excellent question. Excellent question. And the two main categories of tests that I talked about, the PCR test and the antibody test, both of them actually have a fair amount of false negatives. Now, big part of that is if you test too soon, you're not going to get a positive. And so let's say you've been exposed to somebody who had the virus. If you get tested the next day, you're not going to be positive. So in general, the PCR test is going to be positive about maybe 4 to 5 days after exposure. An antibody test won't be positive till about 8 or 9 days afterwards. So some of our false negatives come from that. But we have some really smart people who are really good at understanding these laboratory tests. To, in particular, Drs. Hong and Dr. Pescator, but also are in our lab, Dr. Huerta and Christina Pleasanton, some of the smartest people I have ever known who know very well how to validate these tests. We have every test that we're thinking about, we spend a lot of time validating it, and we've had a lot of tests come our way, and some of them have not performed well, and so we won't buy them. But the antibody tests that we have, we've spent a lot of time. We've tested well over 100 people and compared it with other tests, and we're very happy with that. We know that there's some antibody tests out there that are not good. We're very confident in the one that we have here in Delaware.
Thank you, Dr. Rattay. And a unique follow-up here from Owen Cameron in the live stream comments, who says, I am moving to Delaware from Hawaii on May 30th and have already purchased a home in Milford. Will I have to self-quarantine, and will I be able to go out to the store to purchase basic essentials? Do you have any advice for Owen?
Well, I think that Owen should go ahead and plan to self-quarantine and make arrangements to get things delivered to his home. You know, we can't exactly say what things are going to look like early June, which sounds like, you know, that would be the 2 weeks after he arrives. But at this point, I would at least think about, you know, how he's going to manage and get the things into his home if he's self-quarantining, because that could certainly still be in place.
And Dr. Rattay, I will add, Jonathan, if you don't mind, that that executive order, as you know, is in place now as individuals cross jurisdiction, and we'll give him a welcome, aloha. Right now, Lieutenant Governor Josh Green, who is a public health physician who trained on the East Coast in Hawaii, and their numbers have been trending a little lower. But to the listening audience, both our elected level at our county, to our cities, to our elected state General Assembly, we are all in contact across the country looking at best models. And so I want to reassure him as he travels here from Hawaii that Delaware is in line and putting in place those best practices and conversations that we've had with the leadership in Hawaii, even as far as that state. So give him some confidence when he quarantines, he's going to land in safe community. Jonathan, back to you.
Thank you, Lieutenant Governor. A question from Joe Smith in the live stream comments, Damien, for you. Why is the governor allowed to permit restaurants without an appropriate license to suddenly sell alcohol for takeout? And without weighing into the necessarily the legal argument there, can you talk about the decision to allow restaurants to sell alcohol for takeout and some of the decisions that were made early on and the thinking that went behind those?
Sure. So I think the thinking behind the decision, I'm not an attorney, so I'm not going to get into the legality of that, but I know folks at Department of Justice did feel it was within his ability to do. From an economic perspective, our thinking on that was restaurants, while they make the bulk of their revenue off of selling food, a lot of their profits, which they use to pay their staff, to be able to keep the lights on, to be able to pay all of their fixed expenses, come from the sale of alcoholic beverages with meals. And so these are extraordinary times, and we wanted to make sure that we allow them, when we could, to do some more little things that could help get them closer to where they had been before the crisis. And so they asked that we would consider this, and we felt it was something reasonable, and something that they were already doing delivery and pickup, so minimal public health impact to be able to allow them to include alcoholic beverages with that.
Thank you, Damien. And a follow-up for you from the live stream comments here. Brenna says, other states are opening with restrictions on capacity. I assume that means fire capacity. Is that something we will implement to open sooner to get the economy running again? Is that something that you're thinking about, Damien?
Well, I mean, I think that I can't speak for other states. I know we are taking the CDC guidance very seriously. I said at the beginning, and I'll reiterate here, is we don't want to move to reopen too quickly and have to take one step forward, two steps back. If we start to have see some more spread of the virus, I'll leave the specifics of that to Dr. Rattay. I do know several states in the region have introduced plans to reopen, much like we have, but many are in similar places as we have. We also, when this started, we left a little bit more open than maybe some of our surrounding states. So some states have made modifications in areas like construction and manufacturing, which are actually areas that we didn't close. We worked with those industries to put in some practices to promote healthy workplaces. But some of that are things that we're already enabling our businesses to do. But I think we are working towards a phase 1 reopening, as the other states in our region are as well.
Thank you, Damien. A question from Sherry Sabatino for Secretary Cade. Sherry asked,
if you get tested the next day, you're not going to be positive. So in general, the piece
already purchased a home in Milford. Will I have to self-quarantine?
Cities to our elected. Jonathan, back to you.
Thank you, Lieutenant.
From an economic perspective, we could to do some more little things that public health impact to be able to allow them. I think that I can't speak for other states. I know we are taking the CDC guidance very seriously. I said at the beginning, and I'll reiterate here, is we don't want to move to reopen too quickly and have to take one step forward, two steps back. If we start to have see some more spread of the virus, I'll leave the specifics of that to Dr. Rattay. I do know several states in the region have introduced plans to reopen, much like we have, but many are in similar places as we have. We also, when this started, we left a little bit more open than maybe some of our surrounding states. So some states have made modifications in areas like construction and manufacturing, which are actually areas that we didn't close. We worked with those industries to put in some practices to promote healthy workplaces. But some of that are things that we're already enabling our businesses to do. But I think we are working towards a phase 1 reopening, as the other states in our region are as well.
Thank you, Damien. A question from Sherry Sabatino for Secretary Cade. Sherry asks, regarding the system that is being developed for sole proprietors, independent contractors, will any of those payments be retroactive? Secretary Cade, can you say anything about those payments being retroactive?
So yes, payments will be retroactive to the week of March 15th, which is the week that the governor made his first amendment to the state of emergency, which closed down restaurants and bars. And so independent contractors, self-employed workers, and others would be able to apply for benefits back to that date.
Thank you, Secretary Cade. Dr. Rattay, a question for you from Bill Kennedy about face coverings. Bill says that masks should be required and can be reevaluated in the end of June, but no sooner. All social distancing also should stay until then, at least. You talked about earlier about face coverings being part of a new normal. Can you just talk generally to Bill's point here, how long you expect face coverings to be around, if that is part of the new normal, and any thoughts you have on that?
Yeah, I mean, I can't predict everything with certainty in the future, but here's what we now know about this virus that we didn't know, 6-8 weeks ago, is how common asymptomatic spread is, meaning people who feel perfectly fine are out there, out and about, talking to people and unknowingly infecting people. So, if you're coughing and hacking on somebody, could be spreading germs, but the research on this is showing that even speaking with someone, you can spread the virus. And so, until we have treatment and until we have vaccine, this is now becoming one of our most effective methods. Now, I know people don't like masks. There's, so many different ways to go about covering your face, and finding comfortable ways to cover your face. But my expectation is this is going to be around for a while, because it is going to be necessary for us to keep the reproduction of this virus, the viral spreading, down to a safe enough level where we can, have things open and stay open.
Thank you. And a follow-up for you here from Felicia Anderson, which is really similar to what you were just talking about there. Felicia says, when will we begin testing on those who are asymptomatic? They don't know that they're spreading the virus. And I think that we've done some asymptomatic testing in Sussex County. Can you talk about Sussex County testing and generally when we should be doing testing on asymptomatic folks?
Yeah, so part of it still is, how much do we have in the state? How much tests do we have in the state? And we don't want to, open this widely to asymptomatic testing until we know that, everybody with symptoms is able to be tested. In fact, we talked about this with our hospital partners today. CDC, however, has come out with new recommendations in the last probably 24 hours around testing, and all of our kind of calculations around how many tests that we need to have in state certainly include all symptomatic people, but people who are their direct contacts, especially those who are essential employees, as well as people in long-term care facilities, whether they have symptoms or not. And eventually, we expect all essential employees and extended essential employees to be tested. So this will be phased in. But one thing that we certainly have seen in our work in Sussex County, when we have allowed, now, we're dealing with this hotspot, so we want to do everything we can to decrease the spread. And we certainly are finding a lot of asymptomatic people who are turning positive on these tests. So it clearly has to be a critical piece to our strategy moving forward.
And Dr. Rattay, if I could add, Jonathan, real quickly too, since tonight I know we're also focused on northern Newcastle County and that area, thanks to so many incredible organizations and leaders in our General Assembly and different caucuses, the Black Caucus and groups that have come forward. We have been offering in Newcastle County on standing basis with our hospital systems in coordination with DPH, the opportunity for additional testing. So should you be listening in this evening, and again, have concerns, let us know. And I think as Dr. Rattay will tell you, like many of us who also work in public health, in the meantime, until you have the testing, we have to pretend that each of us are infected and really socially, give your 6 feet distance, wear that mask, because again, those actions and public health education measures are really important. So if you visit de.gov/coronavirus, you can get information there, or call 211. And we can put you in touch with individuals about testing, as well as some other concerns that you might have where you've experienced probably a little stress or some fear around the coronavirus. Jonathan, I'll go back to you now.
Thank you, Lieutenant Governor. And maybe a couple of you want to respond to this. Maybe Damien starts, but Jane Bowen in the Facebook comments asks, will child care centers be given sufficient notice before they are allowed or required to reopen? And can we just talk about the importance of child care and child care as a part of Delaware's reopening plan?
Yeah, sure. I think it's incredibly important. I'm the father of a young child myself who's in childcare services, and we can't really reopen a lot of the businesses that we are starting to engage on, even a phase one limited reopening, and particularly the later phases, phase 2 and 3. It's going to be really difficult for those workers to come back to work in any capacity if they don't have childcare options. And so I think our Office of Childcare Licensing they worked with the providers when they originally rolled out the new restrictions in I think it was the governor's 6th or 7th update to the state of emergency. I know they're engaging them now. Some child care facilities have chosen to close because the volume of children who were in the facility just was not enough for them to be able to bear some of the overhead costs. So working with that community to figure out how we get enough reopened so that when we do have people returning to work, there's someone somewhere for them to bring their children. So there's a critical mass, and that people feel comfortable bringing their children to the childcare center they were bringing them to before. So trying to get as many to get to that mass to reopen as possible is going to be important. I think the way the orders are structured is that as we reopen some of these businesses, even in a limited capacity, we deem them essential, and workers are required by an employer to go back to work, to not be working from home anymore. Even though that will be something that early on, phase 1, phase 2 is something we encourage employers to continue to practice, that work from home. As parents are told they have to return to work, they will be allowed to bring their child back into childcare. But again, it is important that we make sure that their facility is open in order for them to have that option.
Thank you, Damian. Dr. Rattay, this is probably for you. LaShawn Ward asks, how can essential workers who are not healthcare workers get access to PPE? I know we don't have anybody from DEMA on who's been working a lot of the supplies, but LaShawn talks specifically about construction workers who can't find the right masks because they're being reserved for healthcare. Is there anything you can say about PPE, personal protective equipment, for essential workers?
Yeah. So, I mean, we still are not with, adequate PPE, and still supply lines are low for PPE. And so, it's going to be a challenge for a little while for, non-healthcare providers to be able to access PPE. And that's important, obviously, right? It's, as we were talking about before, PPE for healthcare providers, we have to have adequate amounts, but there's other occupations as well. And this is also why, we strongly encourage people not to use face coverings that are for healthcare providers or others. There are many, in construction fields that use N95 masks, but I see members of the public out there wearing N95 masks, that they've purchased at Home Depot or Lowe's, and really want to encourage people, again, there's many ways to, there's, over 1,000 ways at this point to get face coverings, to make face coverings. So let's try to keep all of our PPE for healthcare and those other occupations that need it to be safe in their occupation.
Thank you, Dr. Rattay. I don't know who wants to take this, but this is from Kristen Blanchard in the Facebook comments, who asked about colleges and universities. We've gotten this question from others as well. Kristen asks, will colleges and universities be able to offer in-person classes in the fall? Damian, I don't know if you've had any specific contacts with higher education, or Dr. Rattay, if you can talk about higher education. But Damian, do you want to start?
Yeah, I mean, the best answer is that we're still trying to work with them on a plan to be able to deliver services in a safe way in the fall. I think the CDC guidelines do recommend that by the time you're in phase 2, schools may be able to open in a limited capacity. So that's something that I think comes into play as we consider what our higher education institutions will be able to do as we move into the beginning terms of next year. So I know it's something we remain in conversation with them about. It will obviously depend on how successfully we're able to move through these early phases of reopening, though, exactly what that looks like.
Thank you. And Saran, Secretary Cade, a general question for you at the Department of Labor is, what is the best way for independent contractors or anybody else who's seeking benefits to reach out to the Department of Labor? I know you have a text message service and a bunch of folks working phone lines over there. What is the best way for Delawareans to reach out to the Department of Labor?
We have numerous numbers, but the one of the numbers that is probably the best is 302-368-6600. You call that number, you follow the prompts, and there is a question, there's an opportunity to follow the prompts, speak with a lab operator. You may have to wait on hold for a little bit, given the high number of claims that we're receiving, but you should be able to talk to a person to assist you with whatever.
Thank you, Jonathan, and Saran, Secretary Cade. We're winding out in our last few minutes here before the 7 o'clock hour, and we certainly don't want people leaving frustrated. We will make every attempt to get questions answered, and we will be absolutely taking all feedback back as we look at reopening. Back to you, Jonathan.
Thank you, Lieutenant Governor. So I would encourage everybody. We're going to take one more general question here, and then go to closing comments from you, Lieutenant Governor. But Donna asked this question well. Donna Marshall, Dr. Rattay, who just asked simply, what is the science behind the lockdown? So what is the science behind the stay-at-home order? Can you talk about that a little bit and the science behind keeping people essentially away from other people?
Yeah. I mean, it's obviously something very unique for all of us, right? Most of us have never experienced something quite like this. But this is a virus that is a respiratory virus. It spreads from person to person. Typically, people are going to be about 6 feet apart, and it's spread through droplets, and it's very contagious. And, I'll say it again, because there's still no, treatment or vaccine, we have to take it, even more seriously than we would another virus where, we could prevent it with immunization. So the science behind it is that when you separate people, they're not gonna spread the virus. And when you keep people contained together, it's possible in a household that if one person has it, they may share it, but then they're not going to spread it elsewhere in the community if they're not in the community. And so it works. It works, very effectively, but it's not a way that we can live our lives, until we get a vaccine. We know that. So, but it does work, and that's why you're going to continue to see some measures of social distancing to help prevent the spread until we have vaccine.
Thank you, Dr. Rattay, and thank you for joining us for this tonight. Thank you, everyone who's watched on Facebook and on our live stream page. We would urge anyone to go to visit de.gov/economy, more about Delaware's reopening and recovery efforts. We have, I think, 2 more of these public town halls, so please attend and ask your questions. For the latest updates on coronavirus in Delaware, visit de.gov/coronavirus. You'll also find links there to the My Healthy community page, which has a significant amount of data that our experts at the Division of Public Health watch every day. So with that, Lieutenant Governor, I would turn it over to you for closing remarks.
Yes, and again, thank you. And thank you so much to Dr. Rattay, our Secretary Cade, and to Damian and team, and also to all the members of the General Assembly, our mayors, our councilmen, our county representatives. Thank you for your ongoing participation. I know for Governor Carney and his team, it was so important that we had the feedback tonight from the public. Again, I know an hour goes so quickly, Your comments are so important. And if you haven't had a chance to give us feedback, as mentioned, please go to de.gov/economy. Also, if you need those resources and help, there is available testing to all. Those of you who perhaps have had enough of homeschooling or feeling a little stressed from social isolation, check on your neighbors, check on your seniors in our community and our most vulnerable. Our Department of Substance Abuse and Mental Health has ready free telehealth services, as do a number of our nonprofits here in northern Newcastle County. Again, please reach out to our services, call 211, and continue to wear the mask when you're out, continue to face cover, continue to socially isolate, and together we will be able to move forward. And as indicated this evening, there will be, I'm sure in the near future, measures as we go to reopen. So thank you so very much. Have a wonderful evening. And I hope that you might encourage others to join us in our next couple forums that are open to the public. Thank you. Take care.